sometimes you look up or down, depends on situation. So you look for information. So I think what you need to do, there are some databases which are primary databases. For example, Medline, even Google Scholar. How many of you use Google for medical searches? Yeah, all of us do. I do, and it's very quick. And actually, it doesn't give you a comprehensive hit or two, but it does give you 2 or 3 or 4 very good hits, especially if you have. So it's something that we use, and there is no. It's not bad to use Google for at least some of the searches, but also there is more sophisticated. And then there is this pre-appraised resources. So this is a database or an tool which pre-appraise the literature and giving you a ready package, okay? And I'll try over the next sometime to give you a flavor of these. For example, American College of Physicians Journal Club, ACP Journal Club, or BMJ Best Practice. I'll come across this, which is Access with 4 S's. And this one is free. And for guidelines, you can go to the guideline.gov. It's a very useful site looking for guidelines and compare guidelines. But this one I will tell you about in the next few slides as well. How many of you are familiar with American College of Physicians Journal Club? Good. There are some of you. Do you get an email of them with the pre-appraise? Nice. Okay, very nice. How many of you are familiar with Access? No? That actually Dr. Leo showed it to you in one of his presentations. So it's a very useful site. We will come to it. So that's where you're gonna look for, and we will tell you about some of these things. This table tell you, and I think you will get the presentation. So Adil, Fahad, do they get the presentation?
Yes.
Upon demand. So if you need, just send us an email. We'll give you this. So this is for example, the cost of a subscription to ACP Journal Club with the website. It's not actually a lot. I know I'm up to date with the Kuwait Medical Association. It's only 60 KD, correct? So it's the price has come down considerably. But also with Cochrane collaboration, which the systematic review we did this morning was from Cochrane. And I will tell you about Access, and already told you so. I'll try to concentrate on this. Dynamed, it's actually free through KIMS, or it was free. I don't know if it's still there. It's similar to UpToDate, but it's more concise, and it's maybe not as comprehensive, but it is also evidence-based database, or a textbook, if you like. What do you know about Medline? What is Medline? You know what? Do you know when did it start? How long ago?
From the 80s.
Yes, from the 80s. And so Medlines actually started focus on medical fields from 1879. It was started by this guy, and he was head of the library at the Surgeon General, which is the U.S. Army, and they put the library later evolved into what's called United States National Library of Medicine. And PubMed is the research engine for Medline, okay, for the National Library of Medicine. And the thing that covers articles from 1946 to present. And the size of this, it contains 5,600 journal, 40 languages, 22 million citations, and there are about 2,000 to 4,000 are added each year. And Medline Plus is a patient and consumer database. I think all of you by now, or maybe only 1 or 2 groups left, you will get some exercises on midline searches. And I think most of you found this useful, right? So, however, I just want to emphasize one of the things that during the case scenarios, you noticed the searches was done using clinical query. Are you all familiar with what is clinical query? I see some people raising their, saying yes. But the rest, do you know what clinical query is? Okay, I'll try to do it very quickly. This is the, when you open the page for the midline. So when you do advanced searches, what you did in your exercises, you try to combine searches, you do title or abstract or things. But here, this is called clinical query. And if you click on it, you go into this. And the usefulness of this, as if you are typing a clinical question. For example, outcome of pericarditis. If you, the study we did earlier this afternoon. Or treatment of pregnancy-induced hypertension. So, and the result gives you on the trials, systematic review, or medical genetics. So I ran actually an example here where a diagnosis of tuberculosis as a clinical query. First you get 20,000 articles, but then you can narrow to diagnosis and narrow search, and this will decrease it. So people who are not familiar with the clinical query, try it. It's very useful. And it's the same as in the PubMed or the midline. Okay? Any questions so far? No? The other thing about Cochrane, the systematic review we had with Cochrane, you can do, if you are in search of good systematic review, you can go directly to Cochrane and do the search, which is cochrane.org. Okay? But first we'll talk about the ACB Journal Club. The people who had experience with the ACB Journal Club, can you give me an example how useful it is? Some of you had some experience with ACB Journal Club. No? Can you give me, anybody has good experience with ACB Journal Club? ACB is American College of Physicians. If you go to this site and you subscribe, you get an email. Okay, everything. And the email, I'll show you an example here. You get once a month selected articles, which are pre-appraised. And they give you a one-page summary of these articles. And these articles can apply to different disciplines, so it's not only medicine. And I actually find it very useful because I'll show you an example. For example, this is an email you get every month, and they will tell you about. This is one of the emails included in these 10. I think they include about 10 articles each month. So a cohort study in patients having colonoscopy risk associated with use of anesthesia service was compared with colonoscopy without anesthesia. So gastroenterologists, anesthetists will find this useful. In suspected angina, adding CT coronary angiogram to usual care led to more appropriate invasive angios and increased preventive treatment. So this is a hot topic. Should you use CT coronary angiograms in people suspected of angina? And they give you a pre-appraised. And this is a review, which is intranasal steroids for chronic rhinosinusitis. ENT, allergists are important. And the good thing about it, when you get this is an example of an actual study, it's an old study. Who are the neurologists here? Anybody from neurology? Yeah, okay. In Bell's palsy, what's the current practice? You give steroids. Okay. Do you give at some stage was antiviral being used? Before, just steroids. Okay. So this pre-appraised article, which one page, was published in New England Journal in 2007, and it tells you the question in patients with Bell's palsy, does early treatment with prednisone or acyclovir improve the chance of complete recovery of facial nerve? This is in the pre-appraise. They tell you this study is a 2x2 factorial randomized placebo-controlled trial. Allocation was concealed. The blindness was the clinician, patient, data collectors, and outcome assessors. Follow-up period of. So all you need in a ready package, okay, about some relevant studies. And they present the results like this. Complete recovery, prednisone versus no prednisone. What is the 83% versus 64 at 3 months, at 9 months, and they give you number needed to treat, and they give you the effect size. So it's a summary, and they give you also a conclusion on prednisone and acyclovir. Without going into the result, it's a very nice tool to have. Okay. BMJ best practice. I don't think I have time to do it, but who's Cochrane? Anybody knows who's Cochrane? If you don't know, just guess. Huh? Someone, is he British, North American, Canadian? Okay, actually, Cochrane is Scottish. His name is Archibald Cochrane, and he's born in 1909. And he's not actually the one who started Cochrane, but it was named after him for a reason. And he advocates that everything should be tested in a randomized clinical trial. So he propagating a randomized clinical trial. And that's the idea of Cochrane collaboration, is collection of good randomized clinical trials. And he had an experience where during World War II, he was captured by the Germans, and he was in captivity. But being a physician, he was put in charge of the hospital in the field. And he wrote a book, Effectiveness and Efficiency, Random Reflection on Health Service. This book you can download. He wrote it in 1971. You can download from a PDF, or you can actually buy it. I think the original version cost, I think $10,000, because now it's an antique book. But you can download it from the PDF. I want to tell you this story because it tells you something, that when he was captured, this is in Salonika, which is in Greece, he suspected there are patients coming with edema. He suspected that these patients had wet peri-peri. So what did he do? Because of lack of vitamin B. So this was not in captivity. He decided to do a study. So the way he went about it, I cleared 2 wards. I numbered the patient, 20 prisoners. This for the capture ward. Odd numbers to 1 ward and even number to 1 ward. So is this a good randomization or no? Is it a good? It's not the best, but it's actually not randomization. It's not called randomization, but he tried to separate the patients. And each man in 1 ward received 2 spoonfuls of yeast, because yeast contains vitamin B, and the other got 1 tablet of vitamin C. So he had a control group. Okay? How do you think he measured his outcome? Clinically, okay, what else? If you are doing this study, what else do you measure the outcome? Resolution of the edema, yes. What's more objective? Death, yes, it's more objective, but this is a short study, he wanted to measure outcome. Actually, he asked, because they did not have, he wanted to measure urine output, but they did not have pockets to measure it. So they asked to measure the frequency of urination. Okay, so we had no pockets to urinate, but also I asked the patient, did they felt better, the same, or worse? So he had, and also I asked the patient to walk and judge the level of edema. So this is how he measured his outcome, okay? And he noticed that there was improvement in the patients who had yeast, or the people who had yeast, based on this 10. And he thought this episodes of significant edema and malnutrition was due to B12. And he asked the German to get more yeast, and he got it. And he published this later on, Sickness in Salonika, my first, worst, and most successful trial. And he showed this in the graph that the edema is less. So even in captivity, he did this clinical trial. But actually, in his comment, on reflection, it was not a good trial. I was testing the wrong hypothesis. The edema was not wet peri-peri. The number was too small, too short, but the treatment worked. And the simplest explanation, the small amount of protein in the yeast raised the plasma protein sufficiently to correct fluid balance. This story tells you the story of Cochrane and the Cochrane collaboration, which was named after him. So the importance of doing clinical trials to test anything. Do you know who's the first one who did a clinical trial in the history? Anybody knows? Huh? Manu? Babel? he's another military physician. No? Actually, it's so this they called him back. The way is James Lind, who did on scurvy, and this was in the Navy. People who come with scurvy, and he divided into actually only 6 or 12 patients divided into 6, and the one who did better was the one who was given oranges. So this is the first trial. So the Cochrane Collaboration is a non-profit, started in 1994, and it's all the work is done by volunteers. All the ones who write these protocols are done by volunteers, and for systematic review to facilitate choices with evidence-based medicine. Okay. Now, this about access. This is a cutter that even the people in McMaster started. Is it better now? Okay. So this is the idea of, again, a search engine which give you results in a more systematic fashion. You can sign to it free. You just go, if you search access with 4 S's, you will find it, and you just sign to it. And then when you do the 6S model, what they mean is starting from basically poor evidence to more robust evidence, okay? And the result they give you, for example, this is a non-appraised to, and then based on randomized clinical trials, systematic review, several systematic review, or computerized decision support. So this is the scale. And when you do a study, when you do a search, you get, this is a site, you just have to sign, and you get the results here. Original articles in PubMed, or the clinical query, which they do it in the system, what are the results, and then they give you references to up-to-date and things. So, of course, with this kind, it doesn't give you enough justification on the, not what, actually you can try it, and signing it is free, and you get also email. If you put your area of interest, they send you an email of what are the articles they or what's the recent publication that they got on this. So it's a very useful thing. For example, I recently, you know, in respiratory medicine, we all had thunderstorm asthma. So I did this search on the thunderstorm, and I got these 10 very useful references from this site, okay? So this is the access.